Have you ever had those small, irritating bumps on your skin that look like pimples but aren't? They appear out of nowhere and sometimes can even itch or cause pain. What could they be? And most importantly, how do you get rid of them? Today, we're going to uncover the mystery of folliculitis, a condition more common than you might think, which can be treated with simple solutions, including homemade remedies. Stay with me until the end, as I'll be sharing home remedies and tips that really work. Welcome to our channel. In today's video, we're going to talk about folliculitis. Many people suffer from it without really knowing what it is, and even worse, without knowing how to treat it. We'll explore what causes this condition, how to diagnose it, and the best ways to treat it, both with medical and home solutions. If you frequently deal with folliculitis, this video is for you. Before we talk about treatments, it's important to understand what folliculitis is. Basically, it's an inflammation of the hair follicles, which are the small pores in the skin where hairs grow. When these follicles become blocked or infected, folliculitis occurs. Common causes. Folliculitis can be caused by various factors, such as bacteria, fungi, or even skin irritation from friction caused by tight clothing, shaving with a razor or wax, and excessive sweating. Types of folliculitis. Superficial folliculitis. This is the most common type and affects only the upper part of the follicle. It usually appears as small pus-filled pimples. Deep folliculitis. In this case, the infection goes deeper into the follicle, potentially causing boils or larger lumps. Folliculitis is often confused with acne or other skin problems. However, in most cases, if you notice small red or pus-filled bumps around ingrown hairs, there's a high chance it's folliculitis. Common symptoms. Small red bumps. Itching or pain. Burning sensation. Pustules, bumps with pus. Crusts that form after the pustules burst. When to see a doctor. While folliculitis can often be treated at home, in more severe cases, or if there's no improvement after a few days, it's important to see a dermatologist for proper diagnosis and treatment. Basic care to prevent folliculitis. Keep the skin clean and dry, especially in areas that sweat a lot, like the armpits, groin, and back. Avoid tight clothes that cause friction, especially during physical activities. Change clothes and towels regularly, especially after exercising or activities that cause excessive sweating. Practical tips to avoid folliculitis when shaving. Use new and clean razors when shaving. Using old blades can introduce bacteria into the follicles. Shave in the direction of hair growth to avoid ingrown hairs. Apply post-shaving lotions to soothe the skin and prevent inflammation. Importance of maintaining a skin care routine. Keeping the skin hydrated and exfoliated is essential to avoid blocked follicles. Later, I'll teach you how to make a homemade exfoliator that can really help. Treatment options. If folliculitis doesn't improve with basic care, a doctor might recommend treatments such as topical or oral antibiotics, or antifungals, depending on the cause of folliculitis. Common topical treatments. Topical antibiotics. Used when folliculitis is caused by a bacterial infection. Antifungal creams. Used in cases where folliculitis is caused by fungi. Topical corticosteroids. Reduce inflammation and itching in more severe cases. Other possible treatments. In more serious cases, the dermatologist might suggest light or laser treatments to reduce the occurrence of folliculitis. Now let's talk about homemade solutions. If you prefer to avoid medications or want something more natural, these tips are for you. We'll explore some simple yet effective remedies you can try at home. Warm compress. One of the easiest ways to treat folliculitis at home is to apply warm compresses to the affected areas. This helps relieve pain and opens up the pores, making it easier to drain the pustules. How to do it. Use a clean cloth and warm water. Apply it to the affected area for 15 minutes, 3 times a day. Apple cider vinegar. Apple cider vinegar has antibacterial properties that can help combat folliculitis. How to use it? Mix 1 part apple cider vinegar with 1 part water and apply it to the affected areas with a cotton ball. Aloe vera. Aloe vera has anti-inflammatory and soothing properties that can help reduce irritation and speed up healing. How to use it? Apply the aloe vera gel directly to the affected areas. Leave it on for 20 minutes, then rinse. Tea tree oil. Tea tree oil is well known for its antibacterial and antifungal properties. It can help combat infections and reduce inflammation. How to use it? Dilute a few drops of tea tree oil in a carrier oil, like coconut oil, and apply it to the affected area. Exfoliation with sugar and olive oil. Exfoliating the skin helps remove dead cells and prevent clogged follicles. Here's a homemade recipe. How to make it? Mix 1 tablespoon of sugar with 1 tablespoon of olive oil. Gently exfoliate the skin in circular motions, especially in areas prone to folliculitis. Today we covered everything about folliculitis, from what it is, how to diagnose it, and how to treat and prevent it. If you follow the tips I shared here, you'll definitely see significant improvement. If you enjoyed this content and want more videos with skincare tips, don't forget to subscribe to the channel and leave a like. Also, share this video with anyone you know who suffers from folliculitis. Let me know in the comments which home remedy you'll try first. And as promised, here's an extra tip. If folliculitis is something that bothers you frequently, consider incorporating the regular use of essential oils, like lavender oil, into your skincare routine. Not only is it calming, but it can also help prevent future inflammations. Thank you so much for watching. I hope these tips help you achieve healthier, folliculitis-free skin. See you in the next video.